So an abdominal massage. Cover the area up, make sure the hands are out of the way and you've got some room to work. We're going to come up this time, again, spread our lotion. We're going to come up into the diaphragm. Again, just making a triangle, thumbs and first finger meet. Slide around the sides and draw in. So slide up the centre to make a triangle. Separate your fingers and come around the sides. From a posture point of view, again, you're still rocking and rolling through your back foot onto your front foot. Relax your shoulders. Breathe. So spread our lotion. Now what we're going to do is we're going to do some petrissage, warm up the area. A little bit more lotion on there. So lift tissues from the underlying structures. Some ringing. Again, careful, it's a bit sensitive, so touch with intent, don't be too light or too firm. What we're going to do now is we're going to follow the direction of the digestive system. So the colon, the large colon, goes in a clockwise method here, and then exits the body in this angle here. So whenever we finish, that's where we finish, just on the left hand side, and a little bit of added pressure. So we're going to start off just with some general, fairly light hand on hand, not a lot of pressure on there, and you'll be able to feel the tissues under your hands and also anything that is actually within the digestive system at that point. So we make it as a square as we turn, make a specific turn to go ascending, transverse and descending colon. We can make that deeper by using a fist in a rolling way, just to move things along if things are a little sluggish. Support the wrist. And take it nice and slowly. You can stroke just on this descending colon here, just to help things move. Also on the abdominal we can work on the diaphragm underneath here. Again, different ways of doing it. You can either do it singularly, however you need to protect your thumbs. So we can stroke just with some general effleurage techniques around there, and then you come to the side, fingers on fingers, we can just do some very gentle lifting and stretching circles. We can make this more effective if we get our patient to breathe at the same time. So nice deep breath in for me, and breathe out. We can take that into a nice stroke to improve that again on both sides. Again, nice deep breath in and out. Again, watch your posture, relax your shoulders and just lean into it. Also on the abdomen we can look at the hip flexors. So I'm going to take my patient and lie on his side. So I'm going to ask you now if you wouldn't mind just facing away from me, hold on to your towels. And what we need to do is make sure our patient is in a nice and strong position. I'm going to put a towel under a pillow under his head so he's a little bit more comfortable. Also, and put him into a nice strong L shape, bring the body into a nice L position. I'm also going to ask my patient to move so his body is closer to mine, and that way then I'm not going to be bending or leaning too far over. Now hip flexors, we take our bony markings from the iliac crest and we look at the iliac crest, and just coming down there we're just going to slide down beside the bony points there. If people are quite tense, you might need to get them to breathe. It can be very, very painful, very, very tender, so you do need to take your time with this. You can warm the tissues up with just, again, a little bit of gentle effleurage. Now lower the couch down a tiny bit, so my shoulders are relaxed. And then again, I'm only really going to come along the length from the top of the iliac crest there, just to where my finger is there. So we're not going to be too invasive. If I was working on a female, I would have also checked, you know, through the contraindications, that she wasn't pregnant and that it wasn't the first 2 days of her menstrual cycle. I'm going to start off with just some gentle effleurage in that area. Move on to double-handed effleurage. Again, nice and slowly. If my patient is tensing up, then I would get them to breathe again, nice and deep in through the nose and out through the mouth. I can use my body weight and do some gentle circles. So again, keeping my fingers nice and static. My body weight is just rocking, or I can just gently support his weight with my knee, so he's nice and secure, and then pull back gently to give, again, another dimension to that stretch. So it's lateral to medial, medial to lateral, superior to inferior. Only takes possibly about 20 or 30 seconds this entire massage. It's quite uncomfortable for a lot of people, and you don't need to do it for any longer than that. Take it nice and slowly, and think about your clients and your requirements. Okay. In this position, we can also work along gluteals, the quadratus lumborum, the ITB, the tibial band, the tension fascia lata, and also into the bottom point of the hamstring. So in this position, we can work through powers, just kneading tissues. Stretching some of the associated muscles. Again, our direction, pressure is away from our bony structures, moving the tissues and stretching them.